Hi YouTube, look at this, 3 videos in one day. Crazy, I am playing catch up. But this one is all about my first week on my general surgery rotation, and I have just been loving it. I started on Monday, and all that was on the schedule for that day was colonoscopies and an EGD, and so it was pretty easy. I've worked with this surgeon before, so I've actually already seen him do a few colonoscopies. So I'd already seen ones that wasn't all that exciting, other than I still think the colon is so cool. Like, I don't want to say it's pretty inside, but it's pretty amazing at what the inside of your colon looks like. And after the bowel prep and stuff, and how, I don't know, it looks so clean, and I don't know, it's pretty cool. It's kind of a nerdy moment right there that I just had about saying how pretty the colon was, but I don't know, I appreciated it. And so that's all we did that day, and he kind of talked about expectations and how he had a list of our objectives that I needed to complete by the end, and he told me that every night he'd have like an assigned reading or like an assigned topic. So we were having 2 hernia repairs on Tuesday, surgery set up, and so he had me read on hernias. So like I mentioned in my last video, I would read it out of my Essentials of Surgery, of General Surgery textbook, and I'd use some of my case files to read up on a case, of a hernia repair, and then in my recall book I would read up about hernias and review that. And he said, like, yeah, we'll either talk about it, over coffee or in the hallways or during surgery even, because actually that's when most of it gets done, or when he's doing a colonoscopy, he'll be like, oh, so tell me about, I don't know, talk about a topic. And then that afternoon on Monday, we had clinics. He does clinic on Mondays and Tuesday afternoons. And this is just when you either see people like pre-op, or maybe a consult for maybe they do need to get a scope or maybe they don't, or, his opinion. And then post-op stuff too, people with their gallbladders removed, they'd come in like 1 or 2 weeks after, and he'd look at the sites and ask how they're doing, any symptoms or anything afterwards. And it is so fast compared to like my neurology rotation, where we would spend like half hour to over an hour on some patients, and this is pretty much like 3-4 minutes. I don't know how long it is, but you just go in, ask how they're doing. They don't really have any questions. You do a focused exam, and you're good to go. And a lot of it is consult for just like colonoscopy. They talk about if it's their first time, what it consists of. Some of the people who've already had it don't really have any questions, and we do an abdominal exam, and yeah, it's pretty easy. Then on Tuesdays, he goes to a different town and just does a few surgeries there a week. So on Tuesday, I was able to do that, and that was my first surgery I got to officially scrub in on my real surgery rotation. And little past history of mine, last summer I was here doing a preceptorship, and whenever there was a cool surgery, they would, put me up onto the surgery floor to do that. And on one of the surgeries, I'd already been to a few surgeries before, and I'd shadowed an orthopedic surgeon. Granted, I never was ever scrubbed in, but I'd been even scrubbed in before last year, and excuse me. And then it was an anterior posterior repair on a female, like a rectocele, cystocele. And I don't know why, but I was not feeling very good. I was queasy. I got super hot and trying to like breathe out the side of my mask. Just, trying to keep standing. And finally, kind of everything got blurry. And I remember just focus on what the surgeon's saying. Just focus. And this was a different surgeon I was with, not the one I'm with right now. And it sounded like he was speaking alien. I had no idea what he was saying, and from day one they told me, the surgical nurses were like, you better say something if you're feeling like you need to faint. So I was like, I need to sit down. So they put me in a little chair, and I remember feeling bad that I broken sterile, but probably that was the last thing they were worried about. They were just happy I didn't fall and crack my head open on the floor. And I sat down, and someone was fanning me, and I was feeling a little bit better. And the doctor looks over at me, he was an OB-GYN, and he was like, "Are you pregnant?" And I was like, "Oh my gosh, I hope not." And then that's the last thing I remember. And then the next thing I know, I was in a recovery room, it's still in that little wheelie chair they had me sit down in, and they were like pulling off my gown and mask and hairnet and everything. And so that was, I think, the last surgery I was in on. I mean, I guess I did a C-section afterwards and was fine with that, but I don't know, that was making me nervous, and I was really hoping that it would never happen again. So I made sure to have a big breakfast and everything, but I was just nervous about it. And so when I scrubbed in on this very first surgery, I don't know, I was definitely thinking about it. I'm like, "Okay, don't worry, don't worry." I remember I got up, I'm all, scrubbed in, the nurses helped me and get my gown and my gloves on, and I get up to the table and I have, hands there, and I just kind of feel a little goofy, a little woozy, not completely like I'm going to pass out or anything, but not 100% me. I'm sitting there, I'm just trying to focus on other things, and I'm starting to feel a little bit better. And he's like, "Oh, so can you define hernia?" And I'm just like, "Okay, just breathe, try to think of the question, don't pass out." I'm kind of just trying to stay standing. But then I started feeling better, and I don't think he noticed, because then during the second surgery, I was talking to him. I'm like, "Oh my goodness, I feel a lot better." He's like, "Oh, you're kind of marginal on the last surgery." I was like, "Yeah, the first 5 minutes, I wasn't so sure I was going to make it." So I'm just glad, and I think most of it was just nerves, and I just make sure after every surgery I drink more water, and I always have a snack, and I haven't had a problem since. I mean, always the first few minutes are a little, but usually if I don't think about it, it's not a big deal. So that was really fun. Did those 2 surgeries, and while he dictates his notes, kind of a bummer I don't get to do it when he post-op notes, but I'm going to practice them on my own. He says, "Nope, stay with the patient," and so I get to help the nurses. I actually got to help intubate I actually did intubate a patient, and help the nurses afterwards with, getting him ready and moving them over to the other bed and bringing him over and getting their vitals and everything, and I like that. And I really, during colonoscopies, that's like a routine at this hospital, where I help out the nurses beforehand and get them set and bring them over and then hook them up, and I usually hook them up to the oxygen, and I know which nurse likes which level of oxygen, and afterwards, put the machines back on, hook up the blood pressure cuff. So at least I know I'm learning something, and I know how to work those little machines now, which is an accomplishment, I think. Anyways, just really enjoying it, really enjoying the staff here. They're really awesome. Other surgeries we did this week, I think we did 2 periumbilical hernias, 1 kind of hernia exploration, just like an inguinal one, and what other things? Oh, and then on Friday, was it, or Thursday? I don't remember. We did you removed the gallbladder, and that was so cool because it's all laparoscopic. And so in our surgery lab, we do second year, we had to learn how to use the cameras, and we had demonstration how the trocars are put in, and how you're supposed to watch as they insert that. So I felt really prepared when he had me man the camera, and he's like, "Make sure I'm always in the middle of the screen, and even if something else looks cool, keep it where I'm working." And so I made sure to watch while this things came in, and it was really cool. It was much faster than I thought, and there was like no bleeding, and you pull the gallbladder out through this little pouch, and I don't know, it was pretty amazing. And then that's also when he quizzes me, what's in the triangle of Callot, and what are the borders of it, and what other arteries, and what does the cystic artery come off of, and stuff. So it's really good to know your anatomy, and I've done a pretty good job reading up on it the night before. Then we did some more colonoscopies. It's a lot of those, and some of them aren't always normal. I help pull off a polyp. They have like this little thing that goes in, and a little cautery thing, and it just comes on it and kind of zaps it off, and then they bring it in for like pathology to look at it. What else? Oh, I watched just like a port, where they go in for chemotherapy, and that was pretty cool to watch. That was pretty much it surgery-wise, and then also all my readings. So things I've covered so far are hernias, esophagus, stomach, small bowel, so, it has like small bowel obstruction and all the pathologies with that, and like peptic ulcer disease with the stomach, and that. And then, obviously, when we did our gallbladder surgery the night before, he had me read up on biliary tract and do those cases. So my assignment is this weekend, and actually he won't be back till Thursday, so I actually have a lot. I have to do colon, rectum, anus, an appendix, because we haven't done that yet. And we're seeing, I don't know if it's a consult for a breast lump or something, but I'm going to read up on breast surgeries as well, breast cancer surgery. So that's my assignment for this weekend, and so I'll read up on all those things. And I told him, okay, so I woke up Friday morning, and I woke up and I was just like, oh, you're really loving it. When I woke up, and I was sad that it was a Friday and that my first week was already over. I haven't really felt like that on any rotation so far. I have really been enjoying surgery, but I think the most part is I'm just really enjoying my time here. And with the, everyone who works here has been awesome. I'm living here in the hospital, and I feel so welcomed and everything. Other things, too, is if we have a half day or he had an appointment one day, so we leave early, I just go around. I know the family docs that work here, and just whoever was on call, or even if they weren't, I said, hey, do you mind if I hang out with you? And they're like, sure. And this is where I did my summer preceptorship. So I was seeing patients by myself, and then obviously talking to them afterwards and going in together. And so I just kind of picked up right where I left off, and I think Thursday afternoon, I wasn't ready to be done with my day yet. I wanted to learn more and take advantage of it if you can. If you have half day, I'd rather learn it now than somewhere down the road. And she's like, yeah, why don't you go and see this patient? And she's like, okay, well, what do you want to prescribe for him, or what do you want to do for him? And she's like, okay, why don't you write out this prescription? And it's just so a good feeling knowing that you're trusted and that you actually know something. Sometimes I feel really dumb and like I don't know what I'm doing, but it's nice to know that you're trusted, and I love it. I love family medicine, and so even though I'm on my surgery rotation, I go down with the other docs and do some of that. And also, they cover the ER. And what day was it? There was a woman in labor, and I was really excited because I figured out who was on call, and I asked him. He's like, oh, yeah, I'll definitely let you know when I go up and check on her. And they're thinking she might have to do C-section, but she ended up not, so good for her. And I got to deliver a baby, and I've delivered babies before here last year, actually, and it's not like I'm doing much. I mean, really, first off, it's like the mom does all the work. You just have to make sure you don't drop the baby, and he did all the, cord clamping and cutting and suction and everything, and I just pretty much helped it come out and held it and maybe rubbed its back a little bit to help it cry and clear its lungs, and it was fabulous. I will never get over that feeling of the delivery of a baby. It's like the best feeling in the world, even though it's not my baby or anything. It's just, I'm always just in awe afterwards. And so that was my highlight on Thursday. I was over the moon. I had such a wonderful day. And then they have my phone number, so if anything interesting comes in through the ER, they know to call me, and I go up, and I know I'm trusted again because there's a patient in the ER. He's like, why don't you go see that patient? I'll be over there in a little bit. So it's really fun. I love being here. So it's my exciting week for my weekend. Friday, they had a homecoming parade. So one of the doctors took me there, and we ended up having coffee, and she's great. We just chatted and talked over coffee. And then that night was the homecoming football game, and another doctor invited me over to his house, and so I hung out with him and his wife and kids, and we went to the football game. And it's just so fun to be included in those things and to really get to know a community, because that's what I want to do is small town medicine, and so why not get to know the community while I'm there and what it's really like being a doctor in the small towns, because we'd walk by and people are like, oh, hey, doc, how's it going? And, you're known in the community. And I don't know, so we had a really good conversation about that. And Saturday, I'm trying to get over this cold, as you can hear in my voice, and I thought I was doing really well, but Saturday it just really hit me, and so I pretty much laid in bed, and I have cable TV here, which is horrible because I'm not used to having TV at all. And so I watched like all those crime shows and stuff that I just love, and the mysteries, and I don't know, there's a few other ones on TLC that I was watching. And during the commercials, I would do all my cases online because it would take forever to load the videos. And anyways, that's what I did yesterday. And then today, just went to church by myself, found one that I thought would be interesting, and went there. And again, just get out in the community and see how you like it, because maybe someday I would love to work here, and I already know I really love this town. So that was good. And now I've just been studying away like crazy and making these videos and watching football. So, and I get to see John next weekend, so I'm really excited. So this weekend I was trying to catch up on everything, so that next weekend I don't have much homework to do or studying, and so we can just hang out. We have a wedding to go to, so that's all. That's been my first week of surgery, and as you can tell, I am loving my time here, and I am sad that it's already 25% of the way done, but I'll be back here again for family medicine in the spring, so